Welcome back. The program is still Good Morning Abuja, and right now we have uh, a very someone you want to listen to, someone you should listen to. In fact, what she's about to tell us, what she's going to share with us this morning, is something that we need to listen to here so that we could be better, have a better life as far as caring for our bodies go. And just let me just let her do the talking because there's a lot that she has to say. But join me as I warmly welcome on the show this morning, Dr. Omoye Areta Okun. You're welcome on the show.
Thank you so much, sir. Thank you so much for
Yes.
inviting me.
Dr. Omoye is a primary health physician and a chiropractic associate. Um, I'm sure you're wondering, what do we have in front of us? You can see for yourself. This is what we'll be discussing today. We're going to look at the spine, the spinal cord, right?
Absolutely fine.
Yes. Seeing this, I already know where this conversation is going because a lot of people are dealing with just one thing when the spine is concerned.
Yeah.
And we have lots of people dealing with this. We're talking about the back pain,
Absolutely.
caring for the spine. So, if this is what we are going to discuss today, managing back pain, I think I'll let you do the talking, but permit me to first of all ask what is back pain,
Okay. Very good question.
especially as it has to do with the spine.
Absolutely. Thank you so much again
Thank you
for that
too.
wonderful, introduction, and the question is so important actually. Great. This back pain issue, right? It's like it's so popular right now. Like I
Okay.
said, like more than 80% of the population will suffer one form of back pain or the other
Yes.
at a point in their lives, right? It's so popular. Before it used to be an age related kind of a
Yes.
condition. As you age, generally your spine degenerates just like every other joint in your body, right? And then, but right now, middle-aged people, younger people, children, self for that matter, come down with
Kids.
this back pain issue. Yeah, exactly. So it's just the pain that you feel at the lower part of your spine, the area that we call your lumbar spine. Okay, actually this structure is going to help us because the pain originates from somewhere.
Okay.
But the patient normally complains of, okay, I'm feeling this pain around maybe my waist region.
Yes.
So people say it's not just here alone, it's also radiating to my buttocks and
Yes.
down towards, my lower limbs, down to even the legs. It varies in different individuals, right? So bringing also this skeleton, this structure is just a dry skeleton, but this is the genesis of every single thing. It's a neurological condition. This is the spine. And this is actually a normal spine. This is a lateral view. Try as much as possible to make it, brief. It's divided into different segments. You could see the first region, the neck region. We call that the cervical spine. It's
Okay.
made up of bony structures. These bony structures here. They are stacked upon themselves all the way from your neck down to the low back area. And they are separated by this disc structure here that we call intervertebral discs. They are like cushioning material. Those ones, they nourish the whole joint surface, they lubricate it, they enable ranges of motion. You're able to move around because of those structures in between the vertebra. So we have the cervical region of the spine, the neck region. It has exactly seven bony structures that we call vertebra.
Okay.
And after that, then we have the thoracic region, which is just immediately after the neck region. These ones, there are 12 of these bony structures that we call the vertebra, right? That makes up the thoracic spine. And then the lumbar region, this is the main part.
Please.
Yes, so this part is the lumbar spine, and it's made up of 5 of those bony structures. You see them, the color, this green, right? And as I said, all the joints are separated by this intervertebral disc structure. It's more like a shock absorber or a cushioning material. Right? And if you notice all those yellow things that is pouring out of these holes around here, these are the foramina, these holes.
Okay.
So these are the nerve roots, actually. This yellow, more like an electrical wiring system of the body. These are the nerve roots. It also, spreads out into the nerves, innervation of the whole body. The nerves, for us, the spine is the most important skeleton in human body because it's the seat of the central nervous system, meaning that it houses the spinal cord, and then the spinal nerves emanate from it, supplying all the parts of the body. Every nerve that emanates from the cervical spine region supplies the whole neck, the shoulder joints, all the down to the upper extremity, to your fingers, actually. And then the ones that come out from the thoracic spine region supply the chest wall, the back, the middle back, up until the beginning of the lower back region. And then this lumbar spine, actually, where the issue comes from those that have back pain, low back pain. the nerves that emanate from there supply the whole waist region, that area that they complain about, the buttocks, and all the way down to the lower extremities, right? They are so very important. Like the nervous system is like it's the master system. The brain is sending messages to say, okay, go through these innervations to go supply this and do that. They also supply other internal organs, all the muscle fibers and everything like that. But what happens really is that it could be due to a traumatic incident that happened in life. In life, you could have an accident, maybe a history of an accident or a fall. You could form, or people that play some certain sports are called polo, people
yes.
that ride horses,
Horse
they could
riders.
fall off exactly and land on your back. Any traumatic incident at all that has to do with impact on your body or your spine could cause a shift of one of the bony structures that are called the vertebrae. It could shift out of alignment. The shifting can be actually subtle or it can be very like acute like that. But
Okay.
most times it's subtle. You may never realize it. You understand? And that's actually one part of the causes of this the genesis of the
Yes,
issue.
because I was going to causes now. I wanted to understand what could cause, but you've already answered that. But so allow me to talk about when you mentioned
Yeah.
people who ride who ride horses and play polo as being susceptible to
Absolutely.
back pain
Yeah.
as a result of the damage they could do to their spinal cord. That got me interested. I wanted to know what other lifestyle or factors could be responsible for such. I know in kids there's an advice that say don't carry your backpack on one hand. When we were younger, we wanted to swag along and just it's cooler that way. And when you have just one hand. But
So
then
true.
they keep telling us it's not good for your back. If you continue like this, you're gonna grow up one day and your back is going to hurt real bad. Is that one of the things too?
Oh, so true, absolutely. Apart from the traumatic incidences, right? We have what we call repetitive micro traumas,
Okay.
right? Yes, over the years, it's like wear and tear of life. Maybe most people with professional lifestyles, or if your recreational lifestyle, like the polo instance, as I said. And then you talked about the ones with the children. General postural malhygiene, right? Causes these things like children not knowing how to, carry their bags properly. As you said, that it's uneven when you carry one strap
Yes.
handbag, for example, against the other part of the body. So imagine over the years you're carrying heavy backpacks on one arm alone. The other part is like overworking on
Yes,
one part.
you're stressing
against the
one
other.
part
Exactly, it's
against
not
the
more
other.
balance.
Yes.
And over time, that could actually cause a shift of one of your vertebrae because they're all linked to the vertebra, right? All the whole should I call it postural issues, there are proper ways to sit, for example.
Yes.
You shouldn't just sit anyhow. What we call there's supposed to be regulatory chairs, actually, things like what we call ergonomic chairs. Unfortunately, we don't have like regulatory systems that say, okay, you're working in this office and you're going to be sitting here for like 8 hours or 6 hours.
So you must have.
You should sit properly. You should have good seats, like we call ergonomic chairs, that makes you to, sit upright. Your back is supported. Your back should not be slouched. You should sit upright, and your legs should be firmly rooted on the floor.
ground.
If the chairs are too tall, you can support it with a stool. So postural issues, the way people sit, the way they carry weights from the floor, the way they sleep on the beds, the kinds of bed they use. The ideal beds are actually orthopedic or semi-orthopedic. Beds that when you lie down on them, your weight, you don't indent inside. It's able to bear the weight of your body,
Yes.
right? Those
It
are
spreads
good.
it.
Exactly. So because all these little repetitive micro traumas could cause once that shift occurs, right, the body registers it as an injury.
Okay.
You understand? Then it starts a process of trying to join the vertebra that is above the shifted one and then the one below the shifted one. They tend to pull themselves together, trying to solve all the situation. But in process of doing that, it's not helping the spine at all. It goes kind of in a downward spiral. I made the illustration of somebody that had cut his skin and then
Yes, the skin is healing
yeah, the
itself.
skin is healing. Once how does it go about if you cut your skin? That healing, you see the surfaces tend to pull together, right? And join together. That's actually regenerative for the skin tissue. But for the spine, that same process of trying to pull themselves together because it has noticed in an initial shift is degenerative.
Okay.
It affects the whole integrity of the spine, right?
Yes.
So as it does that, it will lose the natural curvature. These curvatures are normal. This somewhat
This is
shape,
how it's supposed
normal.
to be.
We actually call this a normal lordosis. This mad convexity in front in the cervical region and the lumbar region,
I always
right?
used to wonder why do this whenever I see these things, the
Yeah.
skeletal system, why is it like this? Like I'm
It's
standing straight.
normal.
Is it
Exactly.
as a result of some failure or something? But
No.
hearing you say it's normal, that it
It's
makes me
actually
understand.
normal. Yeah, somewhat
Yes.
like the upper reverse S shape.
Yes.
So the weight bearing regions are mostly the cervical spine and the lumbar spine. Right? Those are the ones that are actually curved, convex, mildly convex in the front in anterior part, and then mildly concave at the back. So this is normal. So
Okay.
when those things happen, when the body is trying to react to the shifted vertebra or something, start pulling themselves, and they lose that natural
Okay,
curvature.
okay.
Right.
Now let's talk about stress.
Oh
Yes,
yes.
how does stress contribute to back pain,
Good question.
and when should one now seek medical attention?
Oh, that's I just love your question because now I because we're in Nigeria, like
Yes,
everybody is stressed, you
yes,
understand? You know, funny enough, the body, the neurological system is just an amazing system in the human body, right? You know, many factors could contribute to individual stresses. You understand? It could
yes,
be your work stress, it could be emotional stress, could be whatever, right? The body responds to stress as though there was danger, as if there
yes.
was like it's a problem, like okay, something's going to happen, right? So it sends this kind of signal. It actually release cortisol, the special hormones that the body releases whenever it's stressed. Cortisol,
Yes,
even adrenaline, you know, is
yes,
ready to fight.
yes.
You understand? As it produces more and more, does the body there's a way all the parameters of the body like crashes down. Even the nerves, they become tense, the muscles and everything. They're not able to function optimally. So
Yes.
as they have that kind of impact on the muscles, on the ligaments, you don't even sleep well when you're in a stressful
You
condition,
can't
right?
even
So
sleep.
most people have insomnia, and
Yes.
when you don't sleep well, your body reacts to it. So all those muscles now begin to be mal positioned, and then as a result of that, your nerves are now more super sensitive to pain. You understand? So let me use the word, they become deformed. They are not in a healthy state anymore. So your nerves are becoming super sensitive to what they call pain. So any little affectation, like any touch or brush, because most times why people feel so much pain is an irritation of your nerves. The
Okay.
nerves are actually around those areas that are affected because the
Okay.
nerves supply the whole system here in the body. So, for example, now if there's a shift now and the body starts to react, the bone starts to form spikes that we call osteophytes. They don't assume their normal contour anymore as it's smooth like this. But when
Yes.
something starts to happen, the body's responding to stress. Even with that trauma that happens is stress for the body. So once the body starts to produce all those sharp edges, the vertebra, they tend to irritate nearby nerves or any neighboring nerve around the body. They irritate it or they impinge on it or strangle them. So much so that wherever those nerves are supposed to supply, the patient starts to feel pain or kind of numbness, or people feel tingling sensation and everything, because all the nerves that emanate from this lumbar spine region, they supply the waist and the lower extremity. There's even a particular nerve that's called sciatic nerve that runs all the way down from the buttocks all the way down to the feet. So if that one is affected, the symptoms are going to go all the way down, right? So all the stressors too. So stress inducing conditions in the body internally also makes the body more super sensitive to those pains, and the
Okay.
body will react. Even the muscle fibers, they become like strangled away from proper circulation. So it really affects them.
Okay. So when should one seek medical help?
In
At what
fact, like
point?
first of all, I want to say it's ideal for you to seek, what they call proactive measures, spinal hygiene measures, even
Okay.
without symptoms, even when you don't have any symptoms yet. You understand? It's so ideal. I cannot even overemphasize that. Just the same way we tell people, make sure you eat healthy foods, make sure you do some form of physical activities, don't be sedentary.
Yes.
You understand? Don't eat processed foods and all of those things. Make sure you see your physician regularly just to get checked generally. That's the same way for your spinal. Your spine, your spine is always predisposed to activities as an adult,
Of
as a
course, it's what
human.
carries you
Exactly, it's
around.
what carries you. You do every activity because of your spine. You understand, and everything, delicate structures that it also contains. Remember, I said the spinal cord is embedded
Yes.
within the spine. So you should also always go see your physician, especially chiropractors, because chiropractors are the one that actually deal with the spine. Now, chiropractors are first of all physicians,
Okay.
so they specialize in everything that has to do with the spine and everything that has to do with innervation, the neurological system. So first of all, you should go for spinal hygiene measure checks and adjustments. Actually, you should at least have a session at least once every month, even when you don't even have symptoms, right? Then, when you start having initial symptoms, maybe like back pain or backache, or kind of, some people don't eat, some people have this kind of feeling of numbness or heaviness or even weakness in their lower extremities. Some people actually feel even knee pains too. They may think it's like knee joint arthritis, but when you go check x-rays of their knees, everything is fine. But by the time you do an x-ray of the lumbosacral spine region, the anterior posterior view, lateral, you start seeing features of degeneration. You understand? So when you're going, routinely just to check yourself, maybe once a month and get yourself adjusted, you prevent, that aspect of, gross degeneration occurring. You understand? Then when you have the symptoms, when anything that has to do with back discomfort or pain, you understand, or any tingling sensation, if you feel you're getting numb in your feet or you're not feeling yourself well, or you're feeling imbalanced, kind of, you can't hold yourself, it feels like your knee, it wants to give way.
Yes.
You should go see your physician. Okay. So I recommend chiropractor just for that purpose, right? So you go there and we'll be able to go run a whole series of, initial evaluations with you, you understand, get your history, and then finally we'll do a physical examination, and then we'll request for a radiological, evaluation as well to be able to see and know the integrity of your spine.
Wow. We'll quickly go on a short break now. We've been having this conversation, but just so we can catch our breaths and take in all we've been hearing from Doctor here, let's go on this short break. Welcome back. We've been talking about managing back pain, and yes, Dr. Omoye is still here with us, and you've been telling us so many things. And now, I want us to delve into what are some of those things that you feel we could do that would at least help in us managing this back pain, like.
Yeah.
Some of those things that maybe from the house, simple exercises or whatever, and then at what point should we carry this to go see our doctor?
Very good.
And when we go to the doctor, who should we look to see?
Yes, great question. Thank you so much. We're just talking about things that most people, if you're not aware, if you don't know anything, if you don't even understand what's going on in your back, it may just be let me just take my regular pain medications. And most people actually on pain medications.
Yes.
Those are just symptomatic relief, and they also have their own side effects, right?
Yeah.
So we try to wean a lot of people off pain medication. So even in the home, we'll have what we call home therapy on your own, even before you're able to see the physician, right? You should understand what we call like spinal flexibility and stretch exercises. They're actually proactive as well, even when you don't have it. It's so important for you to stretch when you wake up in the morning and at night, even before you sleep. Even animals stretch. Have you noticed dogs when they wake up, they stretch. And cats and everything. Those are innate things that God has put in everyone. Because imagine you've been sleeping for 8 hours, maybe pretty much dormant in a particular position. Even if you roll, it's not as much. Your body has kind of been in a sedentary position after 8 hours.
Yes.
So when you wake up, it's ideal for you to stretch. And why do you stretch? When you stretch, actually, like there are specific stretches. We'll be able to have materials to be able to explain. We can't show the stretches.
Yes,
now, right?
Of course.
But there are specific stretches that are so good for the body. It increases circulation in all the muscle fibers in the body. You understand? Circulation increases. If there needs to be detoxification in the process, it does as well. You increase, elasticity. You increase what we call, muscle strengthening. Your mobilization, your joint mobilization. They're not stiffened or they're not shunt of proper circulation, right? Even stimulates, fluid in specific joint area that need fluid, for example, and overall increases range of motion. So it's very good. It helps even in your body being able to take care of the pain, whatever it is you're going through. But that stretch itself, it increases all the vital materials that the body needs to heal itself.
Okay.
In the house. So you do stretches. We also have what we call heat therapy. Heat and cold therapy, actually, we recommend more of the heat therapy when it has to do with chronic, conditions.
Okay.
This back pain you've been having for long and all of those things. If you just had a trauma or heat something, you just use some cold therapy, which helps to numb or tighten your blood vessels and prevent to reduce over, anti-inflammatory reaction. But now we recommend the heat therapy as well. You can just get a heat balm, a hot balm, and maybe a hot water bottle or like that's insulated or an infrared lamp. But we just say, just be careful. You can rub the balm in the area, then place the hot water bottle that's insulated over the area for say 15 minutes when you wake up in the morning, and at night as well before you sleep, right? Wow. So if you don't have a hot water bottle, it's very you can see it anywhere.
Yes, you can. You'll find it in any pharmacy. Yes.
So just place the hot balm first over the area. Any hot balm, could be your deep heat or any of the hot balms you have. place it there and then place it on total bottle. Then you relax. Like 15 minutes. Don't let it be too long and this some other so that you don't get burning yourself too. And then, as I talked about those stretches, the stretches are not so much of how strenuous,
That-
but the consistency, right? When you get
Okay.
it right, just make sure you're repeating it in the mornings and at night, every day. You understand? It's so vital. It helps a lot of our patients actually,
Okay.
right? And then of course you be careful. You should now understand how to be minding your posture, what I talked about, postural hygiene measures, sit
Yes.
properly, don't go carry heavy weighted objects without properly knowing how to position themselves. When you take those measures, sleep properly, lie down on the proper beds, position your pillows well. We have what we call memory pillows that are good to place under your knees and your cervical region to help to keep your spine in the neutral position. There are actually so many of them, but
Yes.
these ones will help actually stretches, the heat therapy, and the postural measures, the postural hygiene measures.
Wow.
Absolutely.
Yes. We've been conversing with Dr. Moyi Areta Okun, and of course, she's a primary health physician and a chiropractic associate. We've been talking about managing back pain. And of course, you can see the passion with which she's trying to explain these things to you because she wants you to be well. Wellness is what we preach here on the program. The program is still Good Morning Abuja. Let's quickly take this short break. When we come back, the program continues. Stay with us.